Hello, I am Dr. Sampurna Ghosh, ENT consultant, Sunshine Hospital Gachibowli. Today's topic is about recurrent ear infection in children. Ear infection are basically of two major varieties. One is Otitis Externa, which means infection of the external auditory canal. The second is middle ear infection. Otitis Externa usually happens when the outside part of the ear canal gets infected. It can be because of some infection traveling from outside. Earbud use is also a very common cause. Many parents think that they better clean the ear of the kids with earbuds, which is actually not required and which causes more problem than good. Sometimes swimming pool water also causes infection in the outer ear canal. This can be easily treated by either oral antibiotic, drops or ointment into the ear canal. And more serious infection which I want to talk today about is the middle ear infection. So, first we have to know what is middle ear. The ear which is behind the ear drum, there is a space like you can imagine a matchbox or like a small room there, which is called middle ear. This middle ear consists of three tiny ossicles or tiny bones by which the sound gets transmitted into the inner ear. Now, like any room needs a window or a ventilation, similarly the middle ear also requires ventilation. Eustachian tube is there which acts as the ventilation channel for this middle ear. The eustachian tube connects the middle ear with the nose. In children, in adult, it is very important that the middle ear gets well ventilated and it is connected to the outer atmosphere. Now, many parents ask me that why kids are more prone to get middle ear infection, why the infection comes back again and again. The reason is the eustachian tube in kids is very delicate, narrow and the angle is more horizontal compared to the adult. How do you know? If the child is 5 years old, 6 years old, normally they complain themselves. They say I have bad ear pain. But if the child is smaller, who cannot express, many a times the primary manifestation will be high fever. The child may not be able to express that he or she is having ear pain. So, it is the duty of the pediatrician or the ENT doctor, whenever a child with high fever, not feeding properly, other causes of the fever being excluded, the next possible option should be the middle ear infection. So, it is very important to check the ear of the child. Treatment for middle ear infection is high dose of antibiotics. Sometime 5 days, 7 days may not be enough. If the pus is not completely gone from the middle ear, antibiotic can be continued for 10 days, 14 days. It is very important for the parents to understand the importance of follow up with the ENT doctor. Even though the fever and ear pain subsides within starting 2 to 3 days of the antibiotic, but many a times the infection actually persists deep inside the ear. So, it is very important that whenever the doctor is asking for follow up visit, you should bring the child and we should be able to see actually the middle ear infection is gone or not. Coming to the next common topic which is causing lot of problem in many children, that is called glue ear. In scientific term, it is called Otitis Media with effusion. Many a times after the infection is over, still the middle ear is not properly ventilated. A kind of thick fluid starts accumulating in the middle ear. The manifestation will be lack of hearing. Hearing impairment in children should be followed up by tests like photon audiometry, impedance audiometry, which is done in hearing centers. There are medicines for it. We can give the medicine, wait for about 1 month, 2 months or maximum 3 months. Many times naturally with medicines and with time the fluid will resolve. But even after 2-3 months, if the fluid is persisting, then the fluid should be drained out. It can be done under local anesthesia or under sedation by putting a very small incision in the eardrum. We take out the fluid and if required, we put artificial ventilating tube which is called grommet. Sunshine, it's sunshine.